Please stand by. We are about to begin. Good day and welcome to the Self-Sufficiency Research Clearinghouse International Childhood Obesity, What are the Options for Low-Income School-Aged Children conference call. Today's conference is being recorded, and at this time I would like to turn the conference over to Faduma Abdi. Please go ahead.
Thank you so much. I want to welcome everyone to the Office of Planning, Research and Evaluation Self-Sufficiency Research Clearinghouse webinar entitled Childhood Obesity, What are the Options for Low-Income School-Age Children? My name is Faduma Abdi, and I'm a domain specialist with the SSRC and the moderator for today's webinar. Now, I will introduce the webinar topic, provide an overview of the SSRC, and introduce our first speaker. As the webinar progresses, I will introduce each speaker. This webinar will focus on childhood obesity among low-income children through the lens of social equity in terms of children's access to food and their physical environments. In addition to providing an overview of this population, we will also discuss the policies that govern their access to food and the physical environments so that we may begin to understand circumstances underpinning differences in obesity rates between children in different socioeconomic statuses and children from different racial and ethnic backgrounds. The association between childhood obesity and social equity has recently been recognized as a public health issue. While childhood obesity has not increased overall in the past few years, the association between childhood obesity and socioeconomic status make it a public health issue. Children from socioeconomically disadvantaged neighborhoods and families are more likely to be obese. Children from minority families and backgrounds are also at an increased risk of experiencing obesity. Finally, studies in wealthy countries found that the design of cities, for example, availability of green areas, parks, and sidewalks, is associated with levels of physical activity. In low-income areas where there are reduced transportation opportunities, less green areas, if at all, and less opportunities to buy healthy foods, the residents, young and old, face an increased risk of obesity. The moderating effect of socioeconomic status determines the individual's social environment, food environment, and natural and built environment. Thus, low-income and minority children tend to live in natural and built environment settings that do not encourage physical activity. They are also less likely to live in places that combine limited transportation and food deserts and therefore are unable to access healthy nutrition options. Over a person's lifetime, childhood obesity is associated with adult obesity, especially among low-income and minority individuals. Today, we will delve further into the relationship between childhood obesity and social equity, discussing the effect a family's socioeconomic status has on child obesity, various approaches to preventing and reducing childhood obesity, and finally, future efforts in terms of policy and intervention. Before we kick this webinar off, I do want to take a few minutes to talk about the SSRC and provide a logistical information on the webinar. The Self-Sufficiency Research Clearinghouse is a virtual portal of research and other resources limited to self-sufficiency. It functions as an online community for researchers, practitioners, and other stakeholders interested in self-sufficiency, employment, and family and child well-being. The SSRC's purpose is to disseminate quality research. We currently have over 6,500 items in our library, and we are constantly adding new resources. The library's materials are organized into 12 topical areas that are listed on the right-hand side of your screen. Every item included in the library is reviewed for relevancy. Users may search by keyword or use filters like topic areas, target populations, geographic location, or research methodology to browse the collection. Every topic area page under the Browse Topics tab includes an Our Librarian Recommends box that highlights research and resources recommended by the SSRC library team. Each topical area page also includes relevant federal laws and regulations. Under the Stay Connected tab, you'll find entities involved in self-sufficiency research and a list of organizations that have partnered with the SSRC to host events and share publications related to the field of self-sufficiency. You'll also find an events calendar that includes in-person and virtual events relevant to the field of self-sufficiency. Please visit this tab to access previous webinar recordings and additional materials. Finally, the SSRC houses a number of data sets and sources to support program management and facilitate improved outcomes for children, families, and communities. On the right side of your screen, you'll find links to the library Emerging Scholars information page and a link to subscribe to our monthly newsletter. Select the title and click the Browse To option for those links to open in a new window. On today's webinar, we will hear from Dr. Greg Gunderson, Eric Callaway, and Geraldine Hanji. A little bit of logistical information before we get started though. While listening to any one of our speakers today, and as this slide mentions here, if you have a question, please type it in the Q&A box at the bottom right of your screen. We'll address all questions at the end of the presentation. And if you can, when typing your question, please mention which speaker you're addressing the question to, so we can kind of then direct the question to them at the end. And finally, a little social media plugs. We encourage you to join today's conversation on Twitter using the hashtag SSRCwebinar displayed on the screen. With that, I will introduce you to our first speaker, Dr. Greg Gunderson. Dr. Gunderson is the soybean industry endowed professor in agricultural strategy in the Department of Agriculture and Consumer Economics at the University of Illinois, is on the Technical Advisory Group for Feeding America, is the lead researcher on Feeding America's Map the Meal Gap project, and is the managing editor for Applied Economics Perspectives and Policy. He's also a roundtable member of the Farm Foundation, a non-resident senior fellow at the Chicago Council on Global Affairs, and a faculty affiliate of the Wilson Sheehan Lab for Economic Opportunities at the University of Notre Dame. His research concentrates on the causes and consequences of food insecurity and on the evaluation of food assistance programs with an emphasis on SNAP.
Okay, thank you, Faduma. I really appreciate that. And I wanted to thank SSRC for inviting me to be a part of this very exciting webinar. And most importantly, I wanted to thank all of you who are on the webinar today. I look forward to your questions that you may have regarding this presentation. Okay, so I'm going to begin with, oh, that didn't come out quite, that doesn't look quite right. But anyway, what this gives is the obesity rates by income quintiles. And you'll see in there is that for children with weights in the 95th percentile of BMI or higher, is that the far left bar graphs are for those who with incomes below the poverty line, and the far right graph is for bar graphs are for those with incomes more than 4 times the poverty line. So one thing you can see clearly on this is that as children's household income increases, is that so too will their probability of obesity decline. So in other words, one of the most effective ways that we can reduce obesity in the United States is, in essence, is to move households to higher income levels. I'm going to be returning to this theme again and again throughout the presentation. The next slide also didn't come through quite right, is what this does is it talks about the rates of food insecurity in the United States for various income categories. And again, what you'll see is on the far left side is you have the food insecurity rate for households with children, for those with incomes less than the poverty line, all the way up to the far right ones, which gives food insecurity rates for those above 185% of the poverty line. So what you see here again is that along with reducing obesity by increasing incomes, so too can we reduce food insecurity by increasing incomes. A key reason why I'm emphasizing both of these things is that a lot of the approaches that have oftentimes been proposed to reduce obesity, including some that I'm going to be talking about today, may lead, in fact, more than may, will lead to increases in food insecurity. So anytime we begin to think about things that might reduce obesity, is we have to, first of all, say, would they reduce childhood obesity? And a lot of things that have been proposed really wouldn't. But the second and really important issue is that we want to ensure that interventions do not cause harm over other dimensions. And in particular, in what I talk about today, is I'm going to be talking a lot about how will the things that some of the things being proposed, will it lead to increases in food insecurity? And unfortunately, oftentimes that is the case. I'm going to talk about 3 policy interventions today. I'm going to be first talking about the soda tax, which is being used in many, many locations around the country. Secondly, I'm going to be talking about some of the issues being posed in terms of SNAP, which would do great harm. And the third thing I want to talk about is recent changes to the structure of school meal programs. Okay, so the first thing that I want to talk about is soda taxes. Okay. And these have been proposed in a number of cities, including in my own state, is that Cook County proposed these soda taxes, but that was recently rescinded, so the soda tax is no longer in place. So the first thing is if we impose soda taxes, do they lead to reductions in soda consumption? Absolutely, no doubt about it. We'll see a decline in consumption. Whenever you raise the price of something, people consume less of it, okay? Will it generate increased revenues? Absolutely. Is the demand for soda is relatively price inelastic, and therefore as price increases, is that people will consume somewhat less, but not that much less, generating more revenue for cities. In fact, that's one of the main reasons why cities have been proposing soda taxes will increase revenues. The third thing is will increases in soda taxes lead to improvements in health? Here's where it gets a little bit tricky, is that there's really no evidence in support of this. So despite all these people saying, oh, we should have soda taxes, there's really very little evidence that it leads to improvements in individuals' health, okay? And in particular, the main thing that these soda taxes are argued for is that it'll help to lead to increases in obesity. And of course, the theme of our presentation today is obesity. And there's really no evidence at all that increases in soda taxes, or soda taxes in particular, will lead to reductions in obesity. So if somebody opposes the argument, oh, we should have soda taxes because it leads to reductions in obesity, the correct response is, well, where's the evidence for that? And then, there is no evidence for it. So all in all, then, is that soda taxes are a bad idea, especially because we know that if you increase the price of any food, is that it will lead to increases in food insecurity. So the main thing that will happen if we impose soda taxes is we'll have increases in food insecurity and hunger in the United States due to these soda taxes. Now, this will come of no surprise for any of you who have looked at some of these issues. Whenever you have a very regressive tax, all sales taxes on food are regressive, and in particular soda taxes are food. So this is why soda taxes are a bad idea. I should also say one more thing about soda taxes in this context is it's not just taxes that are bad. Anything that leads to higher food prices will lead to increases in food insecurity. So we have to be vigilant in our efforts to make sure that prices are low. Okay, that's the first thing I want to talk about, soda taxes. The second thing is I want to talk about SNAP. We can never forget that, by the way, before starting on this, I want to emphasize I'm a huge fan of SNAP. I think SNAP is the best program that we have in the United States today, and it really exemplifies what an excellent government program can do. All government programs should be modeled after SNAP. The first thing we can't forget is that the primary goal is to alleviate hunger. Study after study after study has shown that SNAP is extraordinarily successful at alleviating hunger. And anything that would change the program that would lead it to become less successful at this goal needs to be carefully considered. Now, many of you are familiar on the call is that the SNAP benefit levels are a function of income and family size. As people's income increases, their SNAP benefits fall, and as their family size increases, so too does their benefit levels. This is a generous program, which is, it could be more generous, and in another presentation I could talk about that, but it is a generous program. The maximum benefit level is $640 for a family of 4, so families are getting quite a bit. The other thing about this is that it's a really big program. It's about 60% of the U.S., 60% or more of the USDA's budget, serves about 40 million persons, and the total cost is about $70 billion a year. to its credit is our government has made a concerted effort to fund this program that has major benefits to millions of Americans. Now, I'm not going to go over the eligibility criteria, but in essence is that those getting SNAP are both, their current incomes are low and they have low asset levels. Okay, so unfortunately is that there's some people out there who think that giving families more money in terms of SNAP, because if you don't have SNAP and then all of a sudden you get SNAP, you of course have more money. And there's some crazy people out there who think that because you give people more money, this will make people more likely to be obese, and in particular children. Of course, all of us know this is kind of crazy talk. I mean, nobody thinks that the children of Bill Gates are going to be the largest children in the country because they're some of the richest children. So it's kind of insulting that people will oftentimes say this about low-income households, that by giving them SNAP, that they'll become more likely to be obese. Crazy talk. But nevertheless, there's some people out there still believe this. So, and what we see then is that consistent with this common sense, those of us with common sense, I'm sure all of you have common sense, is know that SNAP doesn't lead to increases in obesity. But what we see is that the majority of evidence that in comparison to SNAP-eligible children, SNAP recipients are no more likely to be obese, or in some cases actually less likely to be obese. And if you're interested, we have this review paper that you can look at. Okay, and there's also some recent evidence that shows that higher SNAP benefits are associated with lower probabilities of obesity. So in other words, those getting more SNAP benefits are less likely to be obese. That's what you'd expect, right? Okay, you're giving people more money, gives them a wider selection to choose from, things like this. So fantastic. There's no evidence of SNAP and obesity. Unfortunately, there are some people out there who, despite no evidence on this, comes in and says, okay, well, you know what we should be doing? We should be restricting what people can purchase with SNAP. The great thing about SNAP today is that SNAP gives autonomy to low-income families. Okay? In today's world, it's really hard to be poor in the United States. Okay? Do we really want to make it even harder for families when they're poor by telling them, the federal government telling them what they can and can't eat? Okay? No, we don't want to do that, but unfortunately there's been calls from across the political spectrum to restrict what we can purchase with SNAP. Okay? Paradoxically, if you impose restrictions on what people can purchase, so for example, you know, if you say people can't purchase, I don't know, 2% milk, you can't purchase 2% milk, or whatever it might be, paradoxically is by these restrictions, it may actually lead to increases in obesity because fewer people will participate in the program. We know for sure, though, that if we impose restrictions on SNAP purchases, this will lead to increases in food insecurity for two main reasons. First of all is that fewer people will participate in SNAP, okay? If you try, nowhere else in our society do we try to tell people what they can and can't eat through various regulations, okay? When I used to work for the federal government, nobody told me how I could spend my paycheck. When I get a mortgage tax deduction every year, nobody tells me how I could send that. It's patronizing and condescending to tell low-income households how they can and can't use their SNAP benefits. So therefore, especially those receiving currently low benefit levels, there'll be declines in participation. There'll also be declines in transaction costs. For both, more evidence on this, as you can see this review paper. And the other thing is that it'll lead to increases in food prices, which also, as I mentioned earlier, leads to increases in food insecurity. So we should all, for those of us who are concerned about the well-being of children in the United States, we should be against soda taxes. We should also be against restrictions on SNAP purchases. Okay, so what are some better approaches? Okay, the first thing is given that SNAP is, at the very least, not negative in terms of children's health, and it's many evidence that it's really positive over multiple dimensions, is we need to resist block granting. There's been some proposals to resist block granting. One of the things is whenever a program is block granted, over time is funding for these programs dwindle, which then means is because funding for these programs, and therefore is its ability to act as a social safety net is diminished because it doesn't expand during good economic times. Okay. The other thing is we should be encouraging increased participation rates. There's so many benefits associated with SNAP: lower lower food insecurity rates, lower poverty rates, lower rates of anemia. I could go on and on about this, but we should encourage more people to be on the program. And even though it's beyond the scope of what I'm talking about today, we have some other work that shows really the profound impact on the well-being of vulnerable households in our society if we had even higher levels of benefits. So rather than being patronizing and condescending towards low-income households by restricting what they can eat, to restrictions is we should instead be moving towards higher benefit levels and more people in the program. Okay, now, so that's my second part of this presentation, is to talk about SNAP, and really SNAP is great. Okay, now I want to talk about the National School Lunch Program. This is a big program, and this is something and it's expected to have a positive impact on the well-being of children. Okay, so this is why this program began, and it continues to have a positive impact on millions of children. And this program is, of course, as you might imagine, lunch is provided through it. And then there were some guidelines that were imposed. And I put this in quotes, this move towards healthier meals, and that's intentional. If you look at what's known in nutrition at any given time period, if we were having this webinar 20 years ago, we would have very different conversations about what constitutes quote-unquote healthy. If we have this conversation 20 years from now, we'd have very different conversations. So that's why it's put in quotes. Okay, so these are some of the things that these guidelines impose towards healthier meals, okay? And so I'm going to come back to that momentarily. The eligibility criteria then for National School Lunch Program is based upon income, and you must attend a school with a National School Lunch Program. So virtually all children in the United States attend a school with a National School Lunch Program, except for children who are homeschooled and some private schools, but in the main areas. But it's mainly an income-based criteria. Okay. Now, the nice thing about National School Lunch Program is benefit levels can be quite high, especially if it's combined with school breakfast and if there's multiple children in households. In fact, some households receive more money from, even those who are participating in SNAP, receive more money from the National School Lunch Program than they do from the from SNAP. Okay, and I just said that. Okay, it's proven a success at reducing food insecurity because A, it provides food to children. So every day the children go to school and they get a meal. That's really, really important. The second thing is it frees up money for other family members. So other family members is that if you have to pay for those school meals, that would come out of meals for other people in the household. So therefore, it frees up money for other family members. And after controlling for selection and measurement error, I'm not going to go into details about this, National School Lunch Programs are at least 17% less likely to be obese. Okay, so we know that National School Lunch Program already led to reductions in obesity even before these quote-unquote healthier meals. So to some extent, this move towards quote-unquote healthier meals is a supposed solution to a problem that didn't exist. Okay, so anyway, it's not clear why it was done. But anyway, it was imposed. Okay, and so what does this then mean? What are some possible responses to new rules? Okay, it's one of the key things that was really bad about this proposal is it put a cap on the number of calories. Okay, now it could be the case that for a lot of children in our society calories are not an issue. However, for low-income households, a lot of those children, the biggest meal they get in a day is that school lunch, maybe combined with the school breakfast. They get home and there's not this. Okay, so therefore they're not going to this. The other thing is that because when they have this responses to these new rules is they may choose to have less healthy meals at other times. Okay, kids need food, and if you're not giving them food, they have to get it some other way. The second thing is a lot of kids are like, look, do I really want to eat these types of food that is in this new lunches? I mean, there's always this attitude like if you give kids the food, then they'll eat it. Well, there's actually quite a bit of more evidence that there's a lot more food waste under these new quote-unquote healthier meals. The other thing is some kids will switch to bringing food from home, which will, they may not be as good as quality as even the healthier the previous meals that were in the program, but also is that it puts a burden on these households in terms of total expenditures. Okay, so what are the potential outcomes? The first thing is there will be increases in food insecurity if these healthier meals are imposed because there's less money available for food if they take them. And there's also less ability to provide needed food at other times of the day. So, for example, when my kids get home from, there's two are in college and one's in senior in high school. But when they get home from school, if they didn't have enough calories in their school lunch, they could just go to my pantry and take whatever they wanted to eat. Okay. Low-income households, though, for a lot of these children, those cupboards are bare. This is why the school meals are so important. They get home and they're not going to be able to get this food that they need at other times of the day. I mean, can you imagine for example, athletes when they're limited in terms of the number of calories, where are they going to get the food when they get home? So there'll be increases in food insecurity due to these impositions, and probably probably almost for certain, increases in obesity. So these, if they move towards quote unquote less healthy meals at other points, or if you bring less healthy meals from home. So in terms of this move towards quote unquote healthier meals in the National School Lunch Program, it's really not a good idea. So to return to what I said at the outset is we have these. First thing is we need to resist soda taxes because they have negative consequences for low-income households in the United States. Secondly, we have to make sure that SNAP retains its success as it has been as a program and not move towards things like restrictions on what people can purchase with it. And third is we have to always remember, whenever we make changes to programs like the National School Lunch Program, is we have to recognize, we have to think first and foremost, in my opinion, but what's the impact on low-income households? For non-low-income kids, it may not make any difference. In fact, there may be some benefits to having quote-unquote healthier meals. However, for low-income households, it was overall a bad deal. And so that's why we've seen increases. So I wanted to thank you all very much for listening to all of this, and I look forward to any and all comments you have.
Thank you, Greg. Next, we have Eric Callaway, Senior Planner at Change Lab Solutions. Eric focuses on the links between systems, the built environment, health, and equity. Eric's 15 years of urban design experience includes streetscape and public space design, district and corridor restructuring, city planning, neighborhood development, downtown revitalization, and healthy community strategies. He has given presentations to a wide variety of audiences on a range of topics within the urban design context. Eric earned a bachelor's degree in architecture from Yale University with a focus on urban design and sustainability. Eric, now over to you.
Thank you very much. So today we're going to look at how the built environment contributes to obesity, starting with how and where people live. The percentage of the U.S. population living in metro areas has steadily and dramatically risen from 28% in 1910 to 80% in 2000. And that growth has almost exclusively occurred in the suburbs, which by 1990 were home to 46% of the U.S. and 60% of metro areas' populations. But the significant population growth which has occurred in the U.S. over that period, or since the end of World War II, has been dwarfed by vehicle growth. As a result of this spread out pattern of development, people travel around 30 miles more per day today than they did in 1950. And these long distances mean more driving and less walking, biking, and taking transit. To the point where, since 1977, 80 to 90% of household trips have been by car. Lost the chart there. In response to this reality, we have designed much of our transportation infrastructure around cars. And this is often at the expense of pedestrians, bicyclists, and transit. For example, as much as 40% of all of our roads don't have sidewalks. And in order to carry more and more cars to alleviate increasing congestion, streets are getting wider and wider, which make crossing distances longer and longer. And many streets lack curb ramps and other amenities that children, elderly, and people with disabilities need to move around. Many communities also don't have enough easily accessible places to be physically active. In most large U.S. cities, less than 1/3 of the population lives within a half mile of a park or easy walking distance. And finally, people, and especially kids, are less likely to go outside and be active in unsafe neighborhoods where graffiti, disinvestment, poor lighting, high rates of crime and violence, and other personal safety concerns are a significant barrier to physical activity. And with all these barriers to physical activity, estimates are that only 1/5 of children meet Health and Human Services physical activity guidelines of 60 minutes per day. Now, children are struggling with healthy weight all over this country, but the problems they face are different in different places, and some places have much more acute problems than others. So in contrast to estimates showing that 1/3 of children are overweight or obese nationwide, it's estimated that 40 to 50% of children in rural communities are overweight or obese. As we heard from Fadumo earlier, When looking at race, Black and Latino children have up to double the rate of obesity as white and Asian children. And as we just heard from Craig, low-income communities see the biggest disparities as children in poor households, shown in red, have as much as double the rate of obesity as children in households exceeding 4 and 5 times the federal poverty level, shown in green. But this is not just about race or income. It's also about place. According to the U.S. Department of Health and Human Services, racial and ethnic minorities are overrepresented in areas of concentrated poverty. So, while less than 1/3 of the U.S. population is Black or Hispanic, 4/5 of communities that have concentrated poverty are made up of Black and Hispanic. And we can see this represented in maps of life expectancy, which show dramatic differences of life expectancy even between neighborhoods in the same city. Factors that contribute to obesity that differ between low-income and high-income communities include access to safe, well-maintained parks and recreational spaces. Communities with high percentage of poor families, shown in red, have fewer resources to build, improve, and maintain parks and other open spaces, leaving more of their parks in need of improvement and less likely to be used. And low-income communities have less access to healthy food options, often relying on liquor stores, fast food, and convenience stores to get their food. And poor households experience more than double the rate of violent victimization than high-income households. And neighborhoods with more concentrated disadvantage, as well as higher densities of liquor stores, tend to experience higher rates of violent crime. This aligns with indications that adverse childhood experiences are significantly more prevalent in low-income families. And all of this contributes to childhood obesity through the emotional distress, unhealthy coping behaviors, and physical activity that exposure to violence can cause. So if the built environment can contribute to obesity, how can changes to the built environment help reduce obesity? Well, each additional hour spent in a car per day is associated with a 6% increase in the likelihood of obesity. By contrast, each additional hour walked per day is associated with a 5% reduction in the likelihood of obesity. And people who live in communities with connected street networks have as much as 15% reduced rates of obesity and related chronic diseases. Not only do children who walk or bike to school get more physical activity and lower their risk of obesity, but studies show their concentration and ability to learn is also improved. Of course, there are safety concerns for children walking or biking to school in places where roads are designed primarily to accommodate cars, because children are 13 times more likely to be injured on a street without sidewalks. But in contrast, people who live in neighborhoods where most streets have sidewalks are 47% more likely to be physically active for at least 30 minutes per day. In addition to sidewalks and bike lanes, streets are safer when they're narrower with slower moving traffic. Vehicle-pedestrian collisions are 900% more deadly at 40 miles per hour than 20 miles per hour. Streets over 45 feet wide have 15% higher speeds than streets under 35 feet wide, making potential accidents more dangerous. 36-foot wide streets have 487% higher crash rates than 24-foot wide streets. And the fewest amount of crashes occur on streets that have 10-foot wide lanes. Finally, studies show that access to recreation facilities is associated with children's physical activity. A longitudinal study shows that 9 and 10-year-old children had significantly lower BMI by age 18 when they lived close to park and space and had access to recreational programs. And the effects of proximity to that open space was even stronger when the neighborhood was more walkable. All this evidence points to changing the physical environment as a powerful way to reduce obesity and improve health. Because while we might have a few doctor visits per year, the other 365 days we spend outside the hospital. So for children, that means how their homes, schools, nearby play spaces, streets, and food environments support healthy behavior and good health outcomes. One way to create healthy environments is to improve the physical activity infrastructure itself. because it's hard to be physically active if there are no safe places to walk, bike, or play. Projects that improve this infrastructure have an immediate impact by creating environments that support physical activity. Improving physical activity infrastructure includes turning vacant lots or parking lots into parks and play areas, improving sidewalks by adding trees, streetlights, and pedestrian amenities, which also result in slower traffic. Improving streets with bulb outs for shorter crossing distances or traffic calming measures to slow traffic, and redesigning or rebuilding streets by reallocating the right-of-way from car use to transit lanes, bike lanes, and wider sidewalks. Now, another way to create healthy environments is to adopt policies that guide change in a community. Policies include local ordinances, zoning, resolutions, and standards in addition to non-governmental organization or company policies. Policies set the context for widespread change. They create the conditions in which programs and initiatives, both public and private, can emerge. In this way, they can reach more people by addressing issues across a community. They help maintain change over time, and they can be extremely cost-effective. Examples of creating a framework for community-wide change include comprehensive plan policies or long-range planning, which commit a city to completing sidewalks, identifying areas for crosswalks and signaling, and prioritizing the funding, construction, and maintenance of safe routes to school, parks, and public facilities. Another example is developing street standards, which address street trees, street lighting, street furniture, traffic calming, and related items. In addition to comprehensive plans, policies which can reduce obesity through change to the built environment include complete streets resolutions, transportation demand management plans, and active transportation plans in transportation, pedestrian-friendly or transit-oriented development zoning standards and design guidelines, open space zoning requirements, shared use agreements, and tobacco-free parks ordinances, safe routes to school and school siting resolutions, healthy food retail licensing ordinances, farmers market, community garden, and urban agriculture zoning, and alcohol density zoning restrictions. So how can we go beyond just reducing obesity rates and actually reduce obesity disparities through environmental change? To do that, we need to make these changes to the built environment, which address healthy eating and active living needs, and look at the poorest, least supported, and most vulnerable people and places first. We accomplish this by taking an equitable approach to policy and investment decisions. So this includes identifying the needs of those experiencing the largest disparities and mapping areas where these needs are concentrated, engaging stakeholders and residents from those areas, prioritizing improvements in areas of historic disinvestment and concentrated poverty, while especially taking care to prevent displacement. Monitoring the implementation to ensure consistent, equitable compliance and enforcement, and evaluating the success of any actions we take in reducing disparities while identifying both positive and negative unintended consequences. Our website has a large library of guides, toolkits, model policies, and educational materials which address many aspects of just, vital, and thriving community, including food, housing, childcare, schools, transportation, public safety, jobs, and the environment. So with some legal language, will take us to our next presenter.
Thank you, Eric. Next, we have Geraldine Hanji, who's the registered dietitian and the director of nutrition policy at Food and Research and Action Center, where her work focuses on nutrition policies, such as increasing the healthfulness of nutrition programs necessary to reach the goals of eradicating domestic hunger and improving the nutrition and health of low-income individuals and families. Ms. Hanji is also the author of a number of web-based tools, including most recently the Child Care Wellness Toolkit, Child and Adult Care Food Program. Ms. Hanji, over to you.
Thank you, Fadumo. I'm happy to be here today to be part of this Self-Sufficiency Research Clearinghouse webinar. It's an excellent opportunity to share with all of you who are logged into the webinar, and I look forward to hearing your questions later. So today I'll be talking about the role of the federal food programs in addressing food insecurity and obesity. I'll start with an overview, and then I'll cover selected state and local policy options. So we know that the federal nutrition programs are key health interventions and supports for those experiencing food insecurity and at risk for food insecurity. I wanted to go over a graphic that is not appearing on this slide. So I'm going to click it one more time, and then we're going to have another slide in which the graphic is not appearing. So let me talk about the graphic that would be on this slide. So it talks about the federal nutrition programs and the fact that they reduce poverty, they reduce food insecurity, they improve dietary quality and protect against obesity, they improve health and well-being. And one of the things that I think it's important to think about is the mechanism by which the federal food programs do this. So the mechanism by which they do it is twofold. One, they reduce food insecurity, which actually helps to improve dietary intake. And two, they directly improve dietary intake in some cases because of the way that they're structured. And when you reduce food insecurity and improve dietary intake, the outcome is, in some cases, to reduce overweight and obesity. So that's the research that we see, that's the mechanism. So let me turn now to, oh, it did show up. Thank you for fixing that, folks who are helping us with the technical aspects of the webinar. So this is the simple mechanism for the role of the federal food programs in obesity prevention, and we just discussed that. So let's move now on to three new reviews of research briefs that Heather Hartland-Graffin, my colleague, produced, and these are great. And they're hot off the press, and we were super excited when we were invited to be part of this Research Clearinghouse webinar because we thought this is a good place to unveil these new briefs, which have the most up-to-date research on them, looking at the impact of poverty, food insecurity, and poor nutrition on health and well-being, and then looking at the impact of the federal food programs in two different briefs. The first is on SNAP, which is also called food stamps, and the second is on the child nutrition programs, which includes WIC. So I have the links to those at the end of my presentation, but we're very excited to be able to, in essence, debut them on the clearinghouse. So let's move now to the second part of my presentation, state and local policy options. So I am going to be focusing on the federal food programs, the Child and Adult Care Food Program, and WIC. And this is planned to fit in well with Dr. Gunderson's presentation because he covered SNAP in schools. So CACFP and WIC are important to the early years, and it is, of course, important to start early with the federal food programs, supporting young children, infants, and families so that when children do enter school, they are ready to learn, they're healthy, and at a healthy weight. So let's move now to the Child and Adult Care Food Program. First, I'm going to say a little bit about what the program is, and then I'm going to talk about a great new change. So the Child and Adult Care Food Program is like the school lunch program, but it's for child care, it's for homeless shelters, and it's for after-school programs, which is school age. So one of the great things, if we talk about programs getting even better, CACFP has an improved new meal pattern and nutrition standards, which are focused on practicality while improving the nutrition standards. Because when you talk about, child care, you're not really talking about people who have nutritionists at the ready to help them plan menus and after-school programs, that kind of thing, and, parks and rec. So these are basically food-based meal patterns. And so those are being implemented this year. This is a transition year, so everyone's learning, but they still get paid if they are, still having to learn the rules and aren't quite getting them, which we think is great that USDA did that. So what we're going to talk a little bit about opportunities to maximize the impact of these of CACFP in order to address food insecurity and obesity, and this will revolve around trying to increase participation and trying to make the most of this new meal pattern. So one thing I thought would be important for you to know is the reach of the program. So it serves 4 million children. That's a lot of kids, and it's a lot of money, $2.9 billion in reimbursements, and it's 2 billion meals and snacks. So it's got a broad reach. Unfortunately, though, there is still a significant amount of after-school and child care who serve low-income children but don't use the program. So we do need to get this program out, and that is one of the key issues in terms of looking at state policy recommendations. So I'm gonna, all right, so this, there's no graphic here, is looking at when you look at the state power, oversight, and authority in terms of addressing obesity in early care and education settings, you have 3 state agencies who are the agencies that can make change happen. And those are the agencies also that can help to increase participation in CACFP. And so the 3 agencies are the Child Care Subsidy Agency, the Child Care Licensing Agency, and the Child Care Food Program. So these 3 focus on the child care settings. They have, as I said here, the power, oversight, and authority. And I want to talk about some things that they can do to make sure that they're maximizing CACFP in terms of addressing food insecurity and obesity. So, and I have to apologize that the graphic isn't coming through because it actually came through in the slide deck when we tested them before. So, but they will be, these will be posted, so you'll get a chance to see the visuals anyway. So let's go next to the slide that talks about the things that the Child Care Subsidy and the Child Care Licensing Agency can do. So one of the reasons I picked this is because I think that often people aren't actually focusing on this system when they think about obesity prevention and food insecurity, but I think it is important, and it's important for people to understand how it works and what are the state and local policy levers within it. So one of the key things when you're talking about trying to get more low-income children who are in early care and education into CACFP is to have these agencies promote the program, refer all the new providers to CACFP, and to share the information about the newly licensed or certified providers with the CACFP agency to facilitate outreach. So those are important. In addition, of course, from a nutrition point of view, it would be good if people had consistent messages. And now that we have the new meal pattern and more of a focus on, for example, whole grains, you know, messages around those key nutrition changes are important. And that's where we get to the next slide, which talks about partners for CACFP success. Here we're looking at state and local initiative projects and coalitions that are key in trying to work on the shared goals of, you know, healthy children. So they can be very helpful in maximizing the impact of the new meal pattern, and they can also be helpful in getting the word out that CACFP is an important program, and after school and child care should participate in it. So nutrition, obesity, and health initiatives, projects, and coalitions, which I think a number of people who are on the call are part of these. And then early care and education, state advisory councils, coalitions, interagency committees, and initiatives. So we see a lot of opportunity for state policy and local policy to come together to work with agencies, organizations, and these initiatives so that people can move forward and really maximize the impact of these programs. So now I wanted to turn to talk about WIC. So the WIC program serves 7.3 million women, infants, and children. It's got a broad reach as well. It serves nearly half of the infants in the country and really a very high proportion of infants in low-income families in the country. Participation in the program has been dropping. So if we look at this non-existent graphic, there's crucial information in this gray bit, which you cannot see. And it's talking about the fact that the number of eligible people are affected by birth rates, poverty rates, automatic eligibility through Medicaid. And so we have seen a decrease in those who are eligible since the recession. However, there are a substantial number of people who are not being served by WIC, particularly the children who are over 1. And there does need to be a big effort and to get those children on the program if we're going to be addressing food insecurity and obesity. So part of what we want to understand if we talk about state and local policy impacting WIC participation are the common barriers. So some of the common barriers, which are also in this slide when you can look at it later when it's posted, are the belief that the family is ineligible, that there are long wait times in clinics, that the program requires too much effort taken altogether because people balance off, what kind of the value of the food they're going to get with what it's going to take to get it. Language barriers, lack of transportation, and then embarrassment and negative interactions in the stores. So if we look at some of the things that it's important for state and local WIC agencies to do, it's WIC outreach and referrals. So people who work at the state agency make plans and then work with the local agencies to implement those outreach plans. The referrals are partnerships, so they could be partnerships with some of you who are on the phone, some of your agencies or some of your organizations. Those are all key referral streams. The main places that referral streams for WIC come from are pediatricians, we're in word of mouth, so those are key. But one of the ways that university researchers are involved in this, and I know a number of you who are on the phone are in fact researchers, is that state agencies can contract and pay for research about WIC in their state. So typically, for a long time, research on WIC has been on outcomes, which of course are fabulous. But increasingly, I think some WIC agencies have had relationships with the universities to look at why people aren't participating and why they drop out. So a recent example is we have a WIC increasing participation project, and we were working with our anti-hunger partner in Oklahoma, and we went to visit with the state Oklahoma agency, and he told us that he had formed a relationship and was paying for research through the University of Oklahoma, which he then got back and was super helpful to him. So phone research, focus groups, universities are well set up to help with that. So let's move next to some other policy options. So if we think about the total time it takes for people to do this and effort costs, that's time away from work. If we think about the distances that people have to travel, again, that's time, and it starts raising transportation issues. So some of the key things that are state policy options are scheduling clinics at convenient times, and also making sure that WIC clinics, such as local public health departments, are open, for example, at lunchtime. I have to say that in some places, public health sort of acts like they have banker's hours, basically. Well, we're all going away for lunch. Well, that's not good if you're a WIC clinic, so you need to be open at lunch, so stagger lunch times, that sort of thing. The other thing is to work in partnership on joint transportation efforts. Morton Clinic that we went to visit, they had a van that went around the neighborhood and would pick people up to bring them for MCH and medical services as well as for WIC. There's another state which has worked with the Medicaid agency and gotten transportation vouchers for some of the WIC folks so that they could get to visits, which I think is great. So let's now move to other policy options that also address this same issue of distance and time, but look at clinic location. So establishing satellite WIC clinics and mobile units in underserved areas is an excellent policy. Rotating WIC mobile units or outstationing WIC workers to spend time at Head Start is key. So we were also working in Georgia, and they had just gotten pilot money from USDA to buy a mobile unit, and they were bringing it to Head Start. And that way they had all of the they could do the hematocrit, heights and weights, everything. They basically had a WIC clinic in there, and they had, privacy for counseling. And so, because there's a lot of kids who are in Head Start who are eligible for WIC but might not be participating. Their parents are busy. But if, they're already at Head Start to pick up their kids, it's not too much trouble to go into a van that's there. There's other issues there where people can work together. So, for example, in Head Start, the parents do a certain amount of engagement with the Head Start. And so one thing is that WIC can come and do nutrition education during some of the Head Start parent dinners so that everyone gets involved and they learn something, and it meets both the Head Start and WIC requirements. So let's focus finally on co-locating WIC clinics and community health centers, MCH. This allows the coordination of appointments and reducing separate trips. And so I did note that some of you are from HUD who are on the phone, and HUD partnerships in terms of WIC clinic locations have also been extremely helpful. So that is another policy that I think that people would want to pursue. So let me just all right, move to the issue of technology. WIC needs to be responsive to millennial moms. Millennial moms don't do things in the old-fashioned way. They want to do things with technology. That's how they communicate, and that's how they find services, and that's how they do business. So state and local WIC agencies, really it's important for them to be able to move forward and certainly help people access WIC, want to participate on WIC, by having good websites, engaging in social media, Facebook, and having well-working WIC apps. And one of the key things about the WIC apps is that, and I showed you a picture here and it did show up, so one of the key things about these WIC shopper apps is that the client, when they're in the store and they're trying to pick out the foods that actually meet the WIC requirements, they can scan the barcode. So that's perfect because they know exactly, what is going to qualify and what isn't. They don't have to go up to, the front of the store and try to check out in front of everyone only to find out that something is not eligible. And the WIC rules, they are complicated because it's very targeted nutrition. So I think this is important, and as people move to electronic benefits transfer in WIC as opposed to paper vouchers, this becomes even more important so people can access a lot of good information here. So we were visiting in Arizona, and they told us that, if they get a complaint about something that happens in the clinic, they can pretty much sort it out. But if something bad has happened in the store, usually people just aren't going to come back because they've been embarrassed. So just a few more things about the stores that I think are important, and these are, again, state policies, which is our focus in the second half of my presentation. It's important to make sure that there are plenty of authorized WIC stores and that they're well prepared to help people with the shopping and checkout experience. And so for that reason, you don't want a state agency to have too many restrictions. So for example, a vendor moratorium in which they won't let any more stores come in. Occasionally there are reasons for people to do that, but they should try to take it up as soon as possible. You want to have appropriate and reasonable vendor selection, particularly when we're talking about small stores, stores that might be in neighborhoods where they're able to look closely at what their cultural foods needs are and really try and help them also in the language that they prefer to speak. And just make sure that when people want to apply, there's a timely and practical process because, if it's once every year, that's not going to do it. So those are some of the state and local policy options that are important in terms of WIC. I just want to wrap up by saying thank you very much for your time and attention, and now I'm going to turn it back to Fadumo.
Thank you, Geraldine, and thank you everyone who has presented and participated and asked questions. Before we begin with the Q&A session, I would like to just announce that I know there's been a little bit of technical difficulties, but the slides will be posted to the SSRC, and you are welcome to email the SSRC if you are interested in the slides that will have some of the visuals that may not have displayed correctly. Now, so now we can move on to the Q&A portion of the webinar. Remember, if you have any questions, please feel free to type them in to the Q&A box on the webinar screen, and we'll get through as many questions as we can in the next 15 minutes. So we've already had a few questions, and I've begun to organize them per speaker. So I will start with Craig, who spoke about SNAP and other and the school lunch programs. So I just want to say that I appreciated that you mentioned stigma, and so I wanted to know the effect that you think stigma has on participation in SNAP and the school lunch programs, both for families and children, respectively.
Sure. So let me first talk a bit about SNAP. Is that so in making a decision whether or not to participate in SNAP, families make decisions based upon the total benefit level, how easy or hard it is to apply for the program. And so those are some of the two main things that they decide upon. And then the third one is stigma. So if the benefit levels are high enough, then families may be willing to overcome the stigma associated with this. If the benefit levels are lower, though, then they may not want to participate in the program. So I think anything we could do to reduce stigma in SNAP will really have enormous implications for the number of people joining the program. In other words, we should be emphasizing how SNAP has benefited literally tens of millions of Americans over the past 50 years, and how important it's been for their life, whether they need it for a short term or for a longer time period. So I think like having public service announcements about how great SNAP is and things like this would go a long ways to helping reduce stigma. In terms of the National School Lunch Program, this is another area where, I mean, things have gotten better. I know that when I was a kid with a National School Lunch Program is that at the start of the class day, the teacher would hand out slips of paper for those who are getting free or reduced price lunch. Fortunately, we've gone a long ways since then, but I still think there's other ways to make sure that children are not either segregated in some way in terms of different lines or different options of what they can get for food. That would also help to reduce stigma, especially since we see some serious problems with stigma, especially amongst older children who could really benefit from the program. So that would be my answer in terms of stigma.
Wonderful, thank you. And I will now move on to Eric's presentation. We got some questions, and so I will try to make this like a two-part question for Eric from two of the practitioners that are listening today. The first part of the question is, can you speak on any of the research that's been done about the effect of the availability of lots and recreation space for low-income children? Considering that vulnerable communities in public, who are in public housing have less access to physical and recreational areas. And then in addition to that, how do we enlist community support for updating the neighborhoods and making them safer?
Sure. So actually, in terms of the research, I think it generally has focused a lot just on availability or lack of availability, and it's interesting because you'll see that it's not always in lower income communities. It's not always that they lack the open space in comparison with high income communities, but also that they're not well maintained or they're not safe. So it's not always strictly an access issue when you're talking about low-income versus high-income communities with open space specifically. But the research definitely clearly shows that proximity to open space and proximity and availability of programs, after-school programs, or other physical activity programs, sports, anything like that, that the proximity and access of those spaces and of those programs is definitely correlated with increased physical activity. And it's very important that, there's like tangentially issues with, team sports, for example, and the pay-to-play model as being a particular difficulty for low-income communities. And so, for those of you who aren't familiar, that's a lot of team sports require payment in order to participate in those team sports, which makes it so that low-income children aren't able to participate in those programs. And the second part of the question, which was how to get communities to participate in, I think you're talking about how to engage communities and get them to participate in the process of community improvement. That is broadly a difficulty with just community engagement in terms of any kind of policy process. So, political engagement, civic engagement, and it's a two-way street. So definitely more recently, there's a lot of working on having basically a wide variety of ways for residents of a community to engage in planning processes. So that includes public workshops, where you have those public workshops in the neighborhoods that have the people that you're trying to reach, instead of having them, say, just at City Hall. That includes planning those workshops at different times of day to accommodate different work schedules. It includes providing amenities at those workshops like childcare or food in order to help make it so that it's not an imposition on people who want to participate. It includes venues in addition to public workshops like online surveys or mailer surveys, as well as pop-up booths at other kind of community events, where just to have as many touch points as possible for different members of the community. And then especially to have materials in different languages to make sure that you can reach out to all aspects of a community.
Thank you for taking on that two-part question. And I will now move on to questions that are coming in for Geraldine as well. One of the practitioners wants to know, what are the biggest obstacles to families on WIC in terms of eating healthy food? They mentioned, is it maybe the access to nutritional food, the cost of the food, decision-making while at the store? And then in addition to that, what are some of the contributing factors that create these obstacles, and what can be done or is currently being done to help families overcome these obstacles? I know you mentioned reaching out to different populations, like the millennial mothers, a little bit differently than an older generation of mothers.
Well, I think, so that's a great question, as interesting different components. So one of the things as it relates to the availability of healthy food, there's two things about that. So there are a lot of SNAP authorized vendor stores. So like you can go, USDA has basically a mapping function, and you can see all the SNAP stores that are in an area. But there are far fewer WIC stores. So in part because it's more complicated. But people have to go further to get to those stores often. And sometimes, even though those stores have made a commitment to have all the WIC foods, they don't always have all of them. So they might have one thing in a category, but they don't have all the things in the category. So that makes it difficult for mothers or fathers who are trying to shop with their WIC vouchers to get everything that they need, and to pick the things, for example, the kind of whole grain bread or the kind of low sugar, high iron cereal that their children actually like and will eat. So that's one thing, and that's why I think it's important to have a lot of different choices, and also it's important to make sure in the vendor requirements and the vendor oversight that they make sure that they have a good selection for everyone. So that's something in terms of the access question. So in terms of the issue about millennial mothers. So if we look at trying to overcome those obstacles in terms of access, we start with the millennial mom trying to decide, what is WIC and am I interested? So how is she going to do that? Is she going to look in the yellow pages? No, she's not going to do that. She's going to look on a website. So first thing is, does the WIC website have the information that she will need to decide, what's the value of the program for her and her family, and then what will she have to do to get it, and what's the likelihood that she might be eligible, so like a pre-screener. All those things are important components of the website for a millennial mom. The second part that's a good component for the millennial mom in terms of a website is there some opportunity for texting? So it's fine if you want to have a phone number. That's great, and almost all the states now have 1-800 numbers, and so that's good. But a lot of millennial moms, they're used to texting or using some kind of email portal. Most of the state agencies don't have that. So those are important. So that's the first step in removing the obstacle for the millennial mom. The second step is when the millennial mom is actually going to participate, can she figure out how to schedule her own appointment? Is that going to be available on a website? That really isn't available most places, but some places are piloting it. Then in terms of participation for the millennial mom, there are some states that are doing a really good job of offering online education for the nutrition contacts. And the way that works is, the mother or the father comes in for the certification or the recertification, right? But in between, there's a requirement for nutrition education. If the millennial mom or the father is able to do that nutrition education and get it done online and have it registered that that's what happened, they don't have to go into the office. So that's important because people are busy. They're used to interacting in a certain way, and it's mainly about choices and flexibility, because some of the time people definitely want to go in and talk to the WIC nutritionist. She knows about things that a new mom might not know anything about. She has a lot of helpful information, and it's a supportive community. But, people can only go so often within their schedule. So that's another thing that I think is really important. And then, as we discussed, the final point I would say in terms of overcoming obstacles for the millennial mom is that when it's time for her to go shopping or the dad to go shopping, there should be an option on the website that would allow them to see all of the WIC stores that are near where they are, so that they will know, what are their choices, that kind of thing. Then the store, we went over many of the things the store should do, but again, in terms of the millennial mom concept, these apps are great. So they're great with using the electronic benefits transfer, but paper voucher states can also use them. And the key thing there is, they can do everything on their phone. They can figure out how much benefits they have left. They can do, they can look and see what's eligible, as I said before, and those are key things because that's how they're used to learning. That's their expectation. Again, they expect to have those kinds of interactions and move forward in the world that way. And because none of us like being embarrassed, right? We will do a lot, getting back to the question about stigma earlier that Dr. Gunderson was addressing. If you get embarrassed at the checkout stand because you don't know, you have no way of figuring out really some of these complicated rules, you can't scan it, everybody's behind you, you're not going to want to keep doing that. None of us would want to keep doing that. So something as simple as an app, which doesn't cost very much, and which you can actually, there's a company that they basically get a subscription for that for. So walking through the whole thing from start to finish, those are key issues looking at technological innovation and communication in terms of the millennial mom, her expectations, and offering her choices that would overcome some of the usual obstacles to participation.
Thank you. We have a few questions that are coming in still and some recommendations. However, I want to be respectful of everybody's time. We are now at 3:17, so I want to thank everyone for participating, asking questions. I want to give a really big virtual round of applause to our speakers. Thank you so much for your relevant information that you all provided on this webinar and your thoughtful insight and research, and for taking our questions, of course. Thank you, everybody. And with that, we will now adjourn the webinar.
And again, that does conclude today's call. Thank you all for your participation.